Hi, welcome to the Family Medicine Sub-Internship Orientation. If you're watching this video broadcast, it means that I'm unable to do orientation in person, and I apologize for that. Even if I'm away, I have my cell phone on, and you should feel free to contact me by email or by text message for any questions that come up related to this experience. Additionally, the family medicine hospitalists are pretty used to dealing with family medicine sub-interns, so they, along with the senior residents that you may be working with, are great resources for additional questions. I want to run through the topics that I normally discuss on the first day of orientation to make sure you have a sense of how things are going to run from day to day. I'm going to also show you a couple of the computer programs, but at a distance to sort of try to maintain HIPAA compliance. Again, questions about specifics or things that are not visible from the video can be asked of the family medicine hospitalist or the residents themselves. So let's talk for a moment about schedules. You all got emailed your schedules from me ahead of time. Again, we are pretty strict about time off policies during this type A elective and don't typically honor it, but things do come up. If there's a critical family illness or personal illness, just give me lots of warning, as much warning as you can, and we'll make arrangements. We usually do have you make up the date that's missed, though. And again, my email or pager or cell phone texting are all appropriate ways to get a hold of me in that sort of situation. You additionally will be responsible for letting your team know, your resident team, so make sure you exchange contact information with your senior resident the very first day as well. So take a look at those schedules. Let me know as soon as possible if there's any major conflicts. Let's talk a little bit about the day-to-day structure of the family medicine inpatient service. So you're watching the video for the inpatient service track rather than the hospitalist track. You may have other sub-Is on with you or on at the same time, but on a different track, and the expectations in the day-to-day is different. So the first step is make sure that you are on the family medicine inpatient service track. That means you're working embedded within a resident team. So there are two teams that are on every day, and there's one resident on at night. The two teams carry about 8 patients, somewhere between 6 and 8 patients, and that team structure is a senior resident and an intern, plus or minus a sub-intern as well. You, as the sub-I, will be following, on your first day, really only 1 or 2 patients, but eventually we'd like to get you up to between 2 and 4 patients, depending on your skill and ability. Only one of those 2 teams rounds with the hospitalist teaching attending for that day. So if you do not round at the bedside with the teaching attending, you will be sitting down and rounding with the teaching attending during sit rounds, or rounds that are away from the bedside. Prior to sit rounds, which typically occur around 11 o'clock, you will be expected to have rounded on all of your patients with your senior resident. Additionally, on the South 6 unit, which is where we try to cohort these family medicine patients who are covered by residents, we ask that you routinely involve the nurses in their care. So this is a collaborative rounding forward, and what that means is the resident team or the sub-intern should make good effort to get the nurse to round at the bedside with you so that they can see your conversations with the patient, participate in answering any nursing-related questions, and hear the plan for the day and hear the patient's own concerns and input about that plan. So this is done by going to the unit secretary and letting them know which patient you're rounding on. The unit secretary will then find the appropriate nurse and page that nurse to the bedside. It's typical, it's required actually, for notes to be done by 2 p.m. On the inpatient team, the senior resident will be giving you specific feedback, 1 or 2 notes per week in detail, but they do need to be reading all of your notes. The senior is not the one who signs your note, however, the attending of record for the patient will read and sign your notes as well, and they often want to render their own individual feedback as well. So you'll be getting feedback on your notes. If it's not happening, please make sure you ask those 2 people for it. It is an expectation of both the senior resident and the attending you're on service with. Usually admissions start pretty early in the afternoon, so by 1 or 2 p.m., the attending will start hearing from the emergency room docs about pending admissions, and you will be responsible for participating in those missions as well in a graduated way as you learn the system. The seniors on a family medicine inpatient service do leave often in the afternoon for clinic. So that will happen about 3 times a week. They'll be leaving around 12:30. So there's a midday sign out, which you should be present for because you want to hear all the information that your senior resident leaves with the triage resident. You're not alone. You're never alone in the hospital. But in the afternoon, you'll be working with a senior resident who might not know your patients as well as your own senior. In terms of expectations for this rotation, we really want you to act in the role of the intern. You'll be doing intern level work in terms of order writing, presentations, H&Ps, discharge summaries, all the patient education, all the discharge planning, including making arrangements for follow-up with PCPs or specialists as appropriate. On rounds, it is your job to present and your job to conduct the patient interview. So don't wait for permission to do that. Take that step yourself in your own initiative, and the team will be appreciative of that. The Blackboard site is really for you to use for your own discretion. I don't track whether or not you've used it. It is the sessions table does have some reading. Really use that as a guide in terms of what topics are important to read about, what you should really be knowledgeable about. By the end of the rotation is all included in that sessions table. There are some readings there. There are some PowerPoint lectures there. Didactics happen on the inpatient service every day between 7:30 and 8:15. It's either a lecture on a core clinical topic or it is a morning report. We also have EKG curriculum 3 Fridays out of the month. These are in the South 6 conference room, again between 7:30 and 8:15. And even when you've been on overnight, we do expect you to stay for the 45-minute didactics at the end of your shift prior to leaving to go home and rest. There is a project involved. It comprises about 15% of your grade for this rotation. There's information on the Blackboard site about that. There are 2 options for the project. You could do a peer education project, which involves a PowerPoint on a clinical topic of your choosing. It should be about 20 to 30 minutes long, and the target audience is your fellow residents on service that month. Additionally, alternatively, I should say, you could do a patient education project, which involves creating a set of discharge instructions for patients around a particular diagnosis. Topics for those need to be cleared with me prior to your mid-month session because those topics we don't want them to repeat. You will have mid and end of block evaluation sessions. Please prepare by printing your mid and end of block forms that are found on the Blackboard site, jotting notes in answer to those questions because we will cover all of the topics there. I personally meet with you. It's always me that meets with you. If I'm on clinically, sometimes the time is a moving target, so try to be flexible in that respect. If you are on the night prior, we'll meet first thing in the morning before you leave for the day. Tracy's going to meet with you the first day of your rotation to talk about some housekeeping stuff like IDs, badging, access to cell 6, parking situation, how to get approval to use the scrub machine on the 4th floor. Again, I know we spoke about this in the email, but you need computer access to Salar and Orient, and Allscripts is helpful as well. If you're taking care of newborns, which is not true in the inpatient service, you would need perinatal centricity, but on the inpatient service, that's not necessary. Everyone needs access to the ED pulse check record. Most sub-Is actually have access, and they just don't know that they do. So please call us if you need any help with that or to reset your password. If you don't have any access and you've confirmed that with IS, send me an email. They require me to know the last 4 of your social security number. And that's really it. There's a separate video talking about the computer programs we use, which is only 5 minutes long. And again, I can be reached easily by text. It's 774-364-0850. And I'll see you at some point during your rotation. Enjoy.